Hey, everybody. Welcome to our show, podcast, Functional Yoga Medicine. I want to welcome those of you who are new to my channel or my podcast and ask you to kindly subscribe. If it resonates with you at all, it's all about really bringing all the pieces of the puzzle in the health and wellness industry as a collective whole to make sense of the whole body as us having an experience for optimal longevity and health. And whatever health looks like for anybody, I think we should be really going after the feeling of feeling healthy as opposed to doing all the healthy things. Because a lot of the times what happens is in our endeavors to pursue health and wellness, that in itself, the must and shoulds and have tos, exercise, eat this, eat that, don't eat this, don't eat that, or didn't meditate, beat ourselves up, that pattern itself is very, very toxic to our system, not recognizing that in our pursuit of health and wellness, that in itself is sabotaging our health and vitality. And so that's something that I want to really bring awareness to you, as I've been really sick for the last 6 to 8 months, struggling with my health and asking lots of questions. It's really, really challenging when you are faced with debilitating symptoms. And I never really understood that until I went through what I had to go through this past year. It really brings up feelings of inadequacy. True vulnerability comes up. And the way we as healthcare practitioners really address our patients is super important. And it's become a vision and a passion of mine to really support each and every one of you to be able to be there truly compassionately for your patients and your clients who need it the most right now. Okay. So today I want to talk about the basic elements of health and wellness. And really, I want to talk about the structure, something that we never think about. I think a lot of the times in our pursuit of knowledge and intelligence and all the things that are out there, from foods to meditation and all the things in between, and we get really lost in the science of biochemistry and physiology. And in our efforts to prove something, right, we want a cause and effect, black and white answer that we can provide to our patients. And oftentimes it's not that black, cut and dry, right? And we need to really address the body as a whole. And a lot of our patients are struggling with lots of things coming their way. With technological advancements, it causes a lot of sedentary lifestyle. You have to put in effort to move your body, right? And when you're stuck in a position, in a seated position, looking at the screen all day, with a pandemic right now, a lot of people are working from home. It really, really forces us to look at what are they physically able to do all day? What can we do to make them win throughout the day so that there is movement to enhance metabolism, detoxification, and all the things that really create health and vitality is to keep and maintain our health and wellness, is to really boost and strengthen and maintain our flexibility in our soft tissue, which is musculoskeletal system. So today I want to talk about these essentials of optimal health, and that is really asking yourself, are you postured for optimal health? Because there are many elements to optimal health. And I feel often we overlook the obvious in search for something more complex. Okay. I used to be that way for a long time. Whatever I learned the thing was, it was the thing that I would go after to really provide the solution for my patients, right? It's whatever method or approach that I learned in that segment of time. That's the solution to everybody that got, so that I can experiment with what I know, right? We live, though, recognize that we live in an advantageous and technologically advanced world where we are constantly occupied with electronic devices bidding for our attention every minute of every day. This not only creates separation from our mind, from our bodies, but robs us of our mindfulness, of our really connectedness from ourselves. And when our mind is occupied with cluttering thoughts from the world, our physiology changes. Posturally, we lack the ability to hold proper posture and alignment for optimal functioning of our nervous system. When we're postured and stooped and low, and we're not mindful of our head space or our physical body in space, we can't even breathe. We can't take a deep breath in. We can't consciously make that breath happen. And breath is really life, right? So it really lends itself to really force us to think about these elemental things that make up health and wellness that we can easily teach our patients. Awareness of oneself is required for us to hold ourselves accountable to what posture is best for us. But when we lose our sense and awareness of our body and space, our structure declines and it atrophies, and many things can happen. More than ever, we need to pay close attention to our posture and create optimal muscle memory to hold us in space to keep our joints and muscles aligned for optimal performance. Because being sick, I know what it's like not to be able to move. And if you don't have that physical strength, boy, nothing matters. Everything that we do keeps us from properly connecting to our body, causing a serious lack of self-awareness that can lead to disease and degeneration. So why does posture matter so much? Well, with increasing sedentary inducing advancements, like I mentioned, like technology, we're not moving as much as we were designed to move. And this creates weakening of our muscles. And when our muscles are weak, we lose strength, flexibility, mobility, and stability to move freely in day-to-day functioning. And as the adage goes, if you don't use it, you lose it. And that's what happens to our muscles and flexibility and our strength, all of it. And when our muscles atrophy and weaken, and it keeps us from moving freely in our lives, it can threaten our overall health and it can threaten all our systems. And movement is essential for metabolism, of course, detoxification, even respiration, breathing, right? pH balance and overall health systems in our body, because it maintains the energetic level in our body to really boost our immune system. And stagnant energy typically lends itself to create toxic, acidic environment where the cells struggle. So it's imperative to keep a healthy environment to keep our cells functioning at its best by taking care of its environment for it to flourish, because we want the cells to flourish to provide us with a nurturing environment from within to get enough energy to do what we need to do from day to day. This means keeping active and moving our muscles. So let's talk about essential structure for our musculoskeletal system, specifically the myofascia. So what is myofascia? Well, we hear so much about myofascial tissue. So myo stands for muscle, and fascia is the tissue that encapsulates the muscle fibers, every bit of it, even our arteries, our nerves, everything is encapsulated by these fascial structures. And these myofascia is a multi-layered, it's sort of like the connective tissue in your body that holds, it stabilizes and connects everything. It's the thing that brings everything together. And without the myofascia, the bones, the blood vessels, the muscles, the organs, and skin won't be able to hold together to form a structure, our body. Think about it like a full body suit covering everything from the top of your head to your toes, including your eyes, nose, lips, and mouth, and everything in your body. It stabilizes the essential part of your body, and it's more than hypothetical glue that holds our body parts together. It's much more smarter and complex than that. This multifaceted myofascial tissue, or fascia as it is sometimes called, is made up of water, hyaluronic acid, collagen, and elastin, but it also contains white blood cells, which is it's a part of your body's immune system that defends against bacterial and viral infections. It prevents disease and destroys even cancer cells. So super important. And then it's also made up of mast cells that protect the body from allergens, toxins, and bacteria. It's like that reactive cell that like alerts the body. And then also fibroblasts, which play an essential role in wound healing and building and repairing the skin. It regulates blood flow to our brains and central nervous system as well. And lastly, it also contains adipocytes, also known as fat cells. And really, the fat cells contribute to the functioning of the endocrine system or the hormone system. So it's full of highly receptive nerve endings that can detect pain, movement when it's stretched too far. It provides us with spatial awareness sensors, and they send signals back and forth from the brain to help you from injuring yourself, from falling or bumping into things unnecessarily. And there are 3 different types of myofascial tissue. It's important to know, right? Number 1 is superficial fascia. It lies just underneath the skin and the dermis, and it connects the skin to the rest of the body, the bones, muscles, and the organs. And it also sometimes is referred to as the subcutaneous layer or hypodermis. And it is this fatty layer of yellowish myofascial tissue that is a vital part of the neck and the spine anatomy. It really separates the delicate structures like the veins, lymph nodes, and the plasma muscle into protected compartments to really hold that together and protect or serve as a protective mechanism, not mechanism, but structure. And then there's the deep fascia. It's this dense and strong fascial layer that supports and protects the muscles, holds our bones in place, and envelopes the tendons, ligaments, and delicate network of blood vessels that run throughout the body. This is where the sensor system serves as it is highly dense with nervous structures that are so receptive to pain and pressure changes in the whole body parts in the system. Okay. And then there's the visceral fascia, which surrounds our internal organs. And this layer keeps our hearts beating, lungs to expand and contract, as well as to keep digestive systems working at its best. The visceral fascia holds these structures in place with a web-like matrix of connective tissue and holds and protects the nerves and blood vessels to keep them functioning optimally. But regardless of the type and the objective of the myofascial tissue, it is always protecting, stabilizing, and maintaining homeostasis. And it really protects us from injury and illness, keeping the body in balance, alive, and functioning. It's like the peacekeeper of your all systems. So why is myofascia so important? What is its link to our posture? Well, inside the body, myofascia is involved in the brain and central nervous system. It's signaling and a host of other chemical reactions, like it's involved in hormone production and immune system function. And there are studies to suggest that a bidirectional link between fascia, hormone balance, even fertility, and postmenopausal symptoms, particularly for women. And if your fascia is functioning well, your hormones are more likely to be balanced and vice versa. So I just want you to understand this profound relationship between something that holds the structure together, so your posture and alignment, right? Perfect. It kind of keeps that homeostasis, and how that's linked to even your fertility for those of us who are women, right? So releasing tension through yoga, the practice of yoga, that's why we love yoga so much at Functional Yoga Medicine, also allows blood flow and oxygen flow around the body without interruption. And then this increase improves the thyroid and pituitary gland function and the ovaries, uterus, and fallopian tubes health. So suppose you're struggling to get pregnant, suffering from hormone imbalances, or severe menopausal symptoms. In that case, it's worth considering practicing yoga in conjunction with other complementary therapies, of course, and advice from your doctor. It always enhances, making you become an elevated practitioner of health and wellness, providing care that matters to your patients. In the case of immune system, myofascia is critical to its proper functioning and therefore disease and serious illness prevention. and the multiple layer of superficial, deep, and visceral myofascia, remember, also protects us from invasive pathogens because we've got so many pretty much the immune cells reside in the myofascia. As the master messenger, which is our myofascia of the body, when the body is stressed or injured in one spot, like a neck, shoulder, or knee injury, the trauma reverberates throughout the body via the sensitive myofascial tissue, really sending the message to our brain to say, ooh, there is an injury, right? So it's easy to see when your posture's not postured properly and you're trying to move through yoga or working throughout the day, and then you go to move a piece of furniture and something happens, myofascia injury can happen, right? And so that's why proper alignment and muscle tissue and really protecting your structure by doing and practicing yoga regularly or some type of dynamic exercise is super important. But more importantly, really being aware of proper posture and alignment. So it's easy to see why problems with myofascia cause a whole host of chronic health problems that can be prevented, that traditional physical therapists and Western medicine doctors miss because they focus solely on the initial site of injury, microscopic view. They focus on the illness or inflammation. And once that spot appears to be healed, they believe their work is complete. But pain often reappears in other body sites that seem unconnected, often many years later, and Western medicine doesn't connect the dots, which where the posture and alignment awareness comes in. First, it's important, again, to bring awareness to the connection with the body. More importantly, to facilitate connection between your patient's body and mind, so they have this internal compass by which they can really read their posture and alignment for proper and optimal healing as well as functioning. So next time you consider solutions to your clients' or patients' problems, consider integrating the basics by addressing simply the posture and alignment by facilitating body awareness, mentor them to really focus on their body to really foster that mind-body connection. It's great to think in fragments. It's how we were taught in school to really microscopically focus on the area of our expertise. But in real life applications, in our patient care, you and I both know we have to pull it all together and address the big picture and address it so that they can apply the concepts, not conceptually we understand, but they don't. And we complain about compliance, right? So this is the foundation of our alkaline methodology, and this is what we teach at the Alkaline Method Academy, where we finally make sense of the whole body by putting the pieces together in a framework, never mind all the dogmatic ways of the training that we got, but we combine all the essential elements to make it accessible for you to tie it all together to make more impact in the lives that you serve. Did you know I'm hosting a free bootcamp? I want you to click the link below. It's in March, and I want you to join me. And it's over a series of 5 days where I teach you to unlock your potential in truly impacting the lives that you serve. Attending this training will give you all the tools that you need to get started right away, to think differently outside the box, outside the scope of your practice, and daring greatly to really make impact in the lives in the way that you want to make impact in their lives. Something that sticks, something that allows them to be self-empowered healers. I hope you enjoyed it. I hope that every episode does trigger you to think differently, think outside the box, and really not constrain yourself, but really apply and apply the wholeness of what's available to you so that you can be a better practitioner at what you do. Thank you so much for joining me, and I hope to see you on that bootcamp. If you haven't done so already, please, please, please review this podcast. I would love to hear back from you, and really DM me or write in the comments below to let me know what other topics you'd like to know or hear more of. I thank you so much, and I will see you guys all next week. Have a great day. Bye.